Did you know that up to 70% of travelers experience digestive issues abroad? Do you know how to protect yourself from it?
You're listening to Via Sana, a travel medicine podcast brought to you by AMSA IMU University with Professor Gerard Flaherty.
Join us as we explore what travel medicine is all about, how you can protect your health while traveling, and the exciting career opportunities in safeguarding travelers.
Welcome back to the second episode of Via Sana, where we talk about all things travel medicine. So I'm Marie.
And I'm Justin.
So last episode, we introduced travel medicine and what it is. But from today onward, we'll be going into the finer details of the field. So if you're a traveler looking for ways to prepare beforehand, this episode is for you.
So today we have two guests joining us. So first off, we have Professor Gerard Flaherty returning for this episode. Hi, Dr. Flaherty.
Oh, hello, Justin. Hello, Maria.
And secondly, we have Dr. Vijay Gnanou, who is Assistant Professor of the Biochemistry Department in IMU.
Hi both, and hi, Prof Gerard.
Hello, Prof. Justin.
All right, and without further ado, we'll hop into the questions. So first off, let's start general. So when we say don't be a last-minute traveler, how far ahead should we plan our travels and why?
Well, the last-minute traveler is actually an entity in travel medicine. This is a term we use, and there's a definition for last-minute travel. So if somebody attends for pre-travel healthcare in the clinic, for example, with less than 2 weeks before their intended departure date, they're called a last-minute traveler. And so, yeah, you're right. We don't encourage this. We normally say attend the travel clinic at least 4 to 6 weeks ahead of your planned travel. Sometimes people come to the clinic and they don't have a definite departure date, and then they can plan around the vaccine series, for example, that's prescribed. Last minute travel is actually more common than you might think. We studied this. We had a collaboration with IMU University, and we did a research project on this. We looked at over 7,000 travelers in our clinic in Ireland, and 17% of them were last minute travelers, which was quite high actually. We found that nearly 4% were recurrent last-minute travelers, so they had a pattern of doing this. But in some cases, it was understandable. Some of the people who were last-minute travelers worked for non-governmental organizations. They sometimes had to go at short notice on a deployment, and so you could forgive them for that. But many of them are just leisure travelers. The most common reason was leisure travel to Asia, actually. And they just attended quite late. Maybe they got last minute holiday deals, or they're just not very organized, or they didn't know you need to go to a clinic earlier. So we always try to educate people if they are a last minute traveler so that they don't become recurrent last minute travelers. And it is an issue, as you can imagine, if you're trying to complete a vaccine series, it may not be possible to do that prior to travel if you only have, in our study, an average of 7.5 days before departure.
All right. And when we talk about needing to prep early, like you said, like 4 to 6 weeks beforehand, who should travelers actually consult for travel medicine related prep? Because I know that there's a lot of people in this field. Who do people go to?
This depends really on where you're living. So it varies around the world. So it's hard to give an answer that would cover everybody's experience. I think we mentioned in episode 1 that travel medicine services are, well developed in some countries. They're really in their infancy in others. But you'll typically find, even where there isn't a well-developed travel medicine service and a network of, professional travel physicians and nurses, that GPs, family medicine practitioners, will pick up the slack. And in actual fact, family physicians around the world probably deliver most travel medicine services as part of a very comprehensive range of clinical services that they already provide. And some are trained in it, have additional postgraduate training, and others do not, but they find it interesting. Sometimes in a multi-partner GP practice, general practitioner practice, one person will have a particular interest in travel medicine. And that's absolutely fine once they're able to provide a comprehensive travel health service. And the GP is the closest to the patient. They're the primary caregiver. So it seems appropriate that this would be offered in primary care. But it varies. In some settings, then people will attend a hospital consultant, perhaps somebody with an infectious disease background, perhaps somebody with a public health background. If it's in a workplace setting and the employee is getting travel health advice in preparation for work-related travel, then they might attend the occupational physician. In a student health unit, they'll go to the student health team. Now, that might comprise a family doctor who specializes in student health and a team of student health nurses. So it varies. Not everybody's the same background coming into travel medicine. And there are specialized travel health clinics that just do travel medicine. But they're much more common in, well, Europe, Western Europe in particular, the US and Canada. But I would say, and Australia, around the world overall, it's mostly GPs.
All right. So it's actually pretty interesting and nice to see that there's quite an interdisciplinary approach to this as well. All right. So that was quite informative on all the who to go for, just like a segue into this general topic.
Okay, so now my question is directed at Dr. Justin. So part of being a prepared traveler is actually acquiring your insurance before your travels in case any issues come up. What are the traits of a good travel insurance policy, especially looking at the medical aspect?
Okay, so based on my personal experience, many people don't take travel insurance. Okay, so that's the truth. But as you know, taking insurance is actually a way of protecting yourself in terms of any kind of health effects happen when you reach that place where you're traveling to, right? So the most common reason why people travel are mostly the tourism is the main way, the reason why people travel. And therefore, you have plenty of insurance available to purchase. But then what you have to really look for, let's say you're buying a travel insurance, based on my personal experiences, number one, covers your hospital care, that hospital in that country. And second thing is, if in case you need to get evacuated back to your home country, then whether your insurance covers. So if you recently know, there was an incident of a Malaysian who had traveled to Japan for a holiday, and he was sick there, and then his insurance didn't cover the evacuation back to Malaysia. So he had to pay a huge amount of money just to get back to the hometown for the care. So that's one important thing. The second thing is for business travelers. So because business travelers are people who are traveling more frequent, so therefore what happens is they are at higher risk than a casual or a tourist traveler. So if you're a business traveler and you're a very frequent traveler, then of course you need to have a slightly higher, or your insurance should cover even more things other than just your healthcare and evacuation, etc. About even luggage, loss of luggage, anything. So it depends on what type of traveler you are, right? I also watch a YouTuber. She drives the motorbike all over the world. Itchy Boots. That's a YouTube channel. Her name is Norali from Netherlands, and she travels all around the world on the motorbike. So imagine she is in one country in one day, and then the next day she travels and crosses the border to another country, let's say South America, and the insurance has to be different for different countries. So you need to travel, and being an adventurer, it's again a higher risk. You might get injured in a no man's land. So many factors are there. So it depends on what type of traveler you are, and of course you have to plan your insurance. The last thing I would like to say is for you guys, you're students, and of course I don't know whether you're from Malaysia, but I'm sure IMU has so many kind of students coming all the way from India, from other parts of the world, coming to Malaysia and study. So of course, you can also consider them as travelers, right? So they are moving in from their hometown back to come to study. So in that few months of adjustment in the new country to study, of course, insurance helps you a lot if you get sick in the first few months. After that, of course, you can get insurance covered by the school, etc. So I think that's my take on insurance. The other point I like to say is, let's say if you have a credit card, check whether your credit card can also have some coverage, because many times you forget that we have a good credit card and this card can cover some amount of health. It's good to know that what kind of cards you have and whether it has some kind of coverage based on that. So that's my experience. Maybe Prof Gerard can add on to if I missed something or.
Well, I think I agree with everything you've said there. One thing I would always remind the traveler, especially if they have a chronic medical condition, is to declare that to the travel insurance company, the travel health insurance company, including any medications they're on or even any past medical history. It's really important to do that. And travel insurance companies really welcome that. And they'll put you in touch with their insurance physician, and that information then will be recorded. There may or may not be a premium loading, but at least all that information is there, because in the event, as you say, that a claim is made, it's really important that the policy would, that the company would honor that. And as you say, it's so important to have medical evacuation insurance. These air ambulance medical evacuations, depending on where you are in the world, but they'll, typically cost 20, 30,000 US dollars. I mean, it really is so expensive. And people think, well, couldn't I just contact my local embassy? They'll help me out. They will help, but not in a financial way. They'll help your family or friends to get money to you. But we've had situations in Ireland, I'm sure you've had them in Malaysia, where poor families have had to publicly fundraise in order to get a loved one home who's rehabilitating or in an intensive care unit in a hospital, and trying to get them medically evacuated. There are certain charities that help with this. There's a very good one based in Ireland which serves the whole island of Ireland. But again, that has limited resources, and it's not good to have to depend on that. So it's really important that people carry insurance. And if they're doing any specialized travel, like high altitude travel, or they're diving to a certain depth, it's really important that the premium or the policy covers that. So they need to check the fine print, which of course is very, very small. So I tell people, use the Control F function on your computer and search for specific keywords. If you're not sure, then just contact the company.
All right. Thank you very much for your insights, Dr. Justin and Professor Flaherty. So one thing we always hear about is fitness to travel, but a lot of people don't actually understand what that means. Professor Flaherty, would you mind explaining to us what exactly is fitness to travel and how the guidelines would work?
Yeah, so fitness to travel is often referred to in the context of air travel. Because with commercial air travel, you've got the physiology there that can affect people with underlying conditions, particularly the hypoxia. Now, the commercial aircraft is pressurized to an altitude that's about 2,300, 2,400 meters above sea level. So you're not at sea level pressure-wise when you're in a commercial aircraft cabin. That's an ideal altitude. It's a compromise for the airline in terms of the fuel needed, in terms of the stability of the aircraft structure, but also it does relate to the oxyhemoglobin dissociation curve. And at that altitude, most people can defend their oxygen saturation, arterial oxygen saturation adequately well. It's not on the steep descent part of the curve. But people with underlying cardiorespiratory illness may desaturate even at that pressure altitude, and that could precipitate, a medical emergency. So we're usually referring to people with heart and lung disease. And there are guidelines in place, but I have to say we've analyzed them recently, and the guidelines vary. In fact, a lot of them are based just on expert opinion or expert consensus, where a group of cardiologists comes together, respiratory physicians, and decide this is an appropriate way. But there are, in some cases, quite robust guidelines based on good evidence, and they're all published. The Aerospace Medical Association, based in the United States, is a good source of these, and they actually make a lot of them available on their website, free to the public. So people with particular underlying conditions or their carers can look there for further information. The kind of things that come up would be if somebody's had a recent procedure, surgery, or colonoscopy or some other procedure like that, when is it safe to fly? if you've had eye surgery, if you're a medical tourist abroad and you're returning home, when is it safe for you to get on an airplane? There is guidance on all of that. Now, people who practice travel medicine need to know though those guidelines, or at least be able to refer the traveler to a source of information, or consult somebody who knows this, because it varies with every procedure. But I would say that another issue with travelers is trapped gas. So, gas in the body cavities expands by about 25% during flight. And so that can be an issue for certain types of patients. It's uncomfortable for many travelers, but it's potentially dangerous for others. So they're the main reasons that fitness to fly occurs. Other things would be mobility as well. Is the traveler mobile enough, to get around the airport and to manage at the destination? But I have to say that in many cases, it's left to the traveler to self-declare that they have some underlying medical illness, and then to inform the airline well in advance. I'd really recommend that. Some people think, well, I use oxygen at home, or I need it sometimes. Therefore, surely the aircraft will have it for me, the airline. No, you must tell them in advance. That has to be a certain medical grade oxygen suitable for aircraft, and they have to know in advance. So once you notify the airline early, they may require a medical fitness to fly declaration from your usual physician, and there are standards there that they can apply. Sometimes the physician has to do certain tests on the traveler, such as check their exercise tolerance or check their hemoglobin, even do an arterial blood gas. It depends on the traveler, it depends on their underlying condition. You can refer a traveler for a hypoxic challenge test if they have an underlying respiratory illness. That's not commonly done. Many people don't have access to that, but it can be done if there's some really awkward case. And this can also apply to travel to high altitude. That's where this arises too. I sometimes get queries about that. Is this patient, they want to go to Everest Base Camp or Kilimanjaro, are they fit enough to travel? And it is an opinion, after all, based on your knowledge of their condition, your knowledge of the likely conditions they're going to meet environmentally there. And it also occur in the context of scuba diving as well. Is the traveler well enough to dive to a certain depth? So it's quite a specialized question in travel medicine, but it does arise from time to time.
All right. So that's talking about the general population. In some populations that, like you said, might have had recent surgeries, or they might be like chronically ill or disabled. And I feel like this conversation for chronically ill travelers and disabled folk, it's pretty important. So speaking of their importance, would you say that airports in general, or any other facilities that, facilitate travel for these people, how well established do you think the systems are for their convenience and for their safety? Do you think the system needs more work, or do you think it's pretty stable developing right now?
So you're referring to the assistance that certain travelers, passengers might need at the airport, is it? And on the aircraft?
Yeah, how well supported these people are.
Yeah. Surprisingly well supported, actually. Airlines have very robust policies around this. As I said, the key thing is that the passenger would declare any illness and talk to the airline about it in advance and about what equipment they might want to use at the airport. Airport assistance is very common. You see people passing you by at the airport who may have mobility issues or may have poor exercise tolerance, and they're being conveyed on these special transporters. I would say that airports with travelators, those sort of moving horizontal escalators. I mean, they're a very good option for people who have mobility or exercise capacity issues. So in general, there's good provision, but it also depends a bit on the airport. I mean, the airports I've used in Asia, I would say, are amongst the most modern in the world. Really, really well designed, well constructed airports. But you might go to a smaller airport in a more remote location that wouldn't have the same level of services. But you can expect, if you had, for example, some severe, an underlying illness that severely incapacitated you or made it difficult for you to get around an airport, that you could be brought to the aircraft in special machines that can actually elevate and bring you right up to the entrance of the aircraft, and you could use a wheelchair. Somebody could even push you around the airport and get you through security and all of that. So yeah, the key thing is that the airport knows in advance. Yeah, but I would say the provision is actually quite good. I don't know if Dr. Justin has other thoughts on that.
Yeah, I agree with Prof Gerard, especially the airports in Asia are well equipped and modern. And personally, I have when my father and his brother, they were traveling in Qatar they were just transiting through Qatar, and they had a transit time of 6 hours. So they are old, so they are 18 plus. And they wanted to do some shopping. And of course, they were walking around, and my uncle slipped in that nice and shiny floor and fell down. And he almost lost his consciousness. But there were support from the airport immediately. The airport people came, put him on a stretcher. They shipped him to a hospital. They made him, insurance, of course. That's where the insurance also came to a very good help there, and they recovered. So I think that way the response in the airport is quite good. In terms of even if there's an emergency, even if, like Prof Gerard says, maybe you have to declare before if you have an illness. But if there's some kind of emergency happening, so I'm sure that I think with this experience, I know that you can get help from the airport. Yeah.
And I might add there, if a medical emergency were to occur in flight, the medical kits that are carried by the airlines, at least the larger commercial airlines, are very well equipped. There is a seal on them that has to be broken, so somebody with medical training has to confirm that they're adequately qualified. There typically is somebody with a healthcare background on board who can help out. But also the flight crew are also very well trained in basic life support. And again, most of the aircraft will carry an automated external defibrillator. It's very difficult to render emergency care to a high standard aboard an aircraft at cruising altitude, as you can imagine. But airlines also have access to very good ground-based telemedical support. So yeah, we hope we never need these services, but if we're ever the ones who are helping a passenger in distress, it's good to know that there is that backup there.
That's really good to hear, actually, the preparations, and I'm sure quite a relief for some of our audience as well. So speaking of these more vulnerable groups, I believe at least that they're more prone to getting illnesses, but I think we can widen our approach here because these vulnerable groups aren't the only people who might get sick. So in terms of traveler diseases, what are the most common ones you see recently?
Well, in general, the most common international travel-related disease would be traveler's diarrhea. So this is very common, but it depends on where you're traveling from, where you're traveling to. You may actually be traveling from a country with a higher incidence of traveler's diarrhea from food and water consumption to a country with a lower incidence. So in that case, you don't expect to get ill. But very often, thinking of where I'm based in the world, in Ireland, traveling to the tropics, the incidence of traveler's diarrhea is very high in many countries. And so that would be something that would occur commonly. For most travelers, it's a mild illness with an average duration of about 2 days. But in about 10% of cases, it's severe. In some cases, moderately severe. And those travelers really, I tell travelers that they're the cases I'm really trying to prevent, those more severe cases that could end up in hospitalization or some complications like irritable bowel syndrome or reactive arthritis. So that is common. Insect bites are very common. And sometimes they're infected with just bacteria on the skin, or they may be infected. There may be transmission of a vector-borne disease. And the most common cause of fever in the returned traveler from the tropics in many studies is dengue infection. So again, that will be something that will be commonly seen. Lots of skin rashes, actually common skin infections. The most common cause of death, not to be too morbid about it, but most common cause of death in travelers, well, especially younger travelers, is road traffic collisions, road traffic trauma. So people involved in road accidents. And there are other types of trauma as well that cause death in travelers, such as drowning, fires, and so on, falls. The most common cause of death in the older traveler, it's hard to put an exact age barrier on this, but that would be cardiovascular disease, which is the same as domestically. It's the most common cause of premature death in adults in the Western world, and increasingly in developing countries as well. So I suppose that gives you an idea of what are the major causes of illness and death in travelers, but there's a lot of other things as well.
So that's quite a lot for our travelers to have to keep an eye on. But with all of this knowledge about these, like, what are the most common causes of, like, injury, illness, in our travelers, there's got to be some preventive measures as well. Specifically, we're looking at some prophylactic medicines, perhaps. But I feel like a more common concern that travelers might have already is vaccinations. Dr. Justin, I just like to direct this question to you. So for vaccinations, what are the common vaccines, and also let's say, what challenges does travel medicine face in terms of having to address vaccine hesitancy?
Okay. So most common, if you ask, what comes to my mind is based on my experience against the yellow fever vaccine. So basically, because it's a mandatory vaccine, because you have to also to follow up a question about hesitancy. Sometimes when it is mandatory, then there is no more hesitancy, because you want to travel to this place, you better get the vaccine to enter that place, right? So yellow fever vaccine is a mandatory vaccine. I think even for Malaysia, it's a mandatory vaccine to come in. If you're traveling from a country which is endemic for yellow fever to travel to Malaysia, you need to have the yellow fever vaccine certificate. So that's one that comes. Malaria vaccine is the second one which comes to my mind, which is more commonly done. The flu vaccine, of course, depending on where you're traveling, flu vaccine. I think traveling to China, I guess you need a flu vaccine. I'm not sure. Maybe Prof Gerard can correct me on that. But these are the three vaccines which comes to my mind. Talk about vaccine. So vaccine hesitancy, as I told you, I think it's a mindset. So if it is mandatory, I think people have to take it. But then I'm not sure. I don't know how to answer this question about hesitancy, why people are hesitant. But I think it's more of your own understanding of the role of vaccine itself in preventing in disease. So that's my take on this vaccine. Yeah.
We could do a whole episode, I think, on vaccine hesitancy. I mean, it does arise for sure in travel medicine practice, but I always say, well, if the traveler has attended the clinic and is, clearly they want to be protected during their travel, so that is a great start. The most important thing for me actually would be the travel health advice we give, the education. That I would put first. The vaccines come later. And sometimes the traveler will need very few, if any, vaccines, actually. So I wouldn't make the vaccine the main focus of the consultation. So the advice, the education, and then a risk assessment. In travel medicine, we perform a risk assessment. And then based on that, we'll consider whether or not vaccines are appropriate. But it's really important to respect the traveler's health beliefs. They may have views towards vaccines based on their experience or information they've read, can be misinformation, and it's important to address that and give them a chance to ask you questions. I like to be quite matter of fact when I discuss vaccines. I like to, and you're a biochemist as well, Dr. Justin, so I like to explain the process of immunization, because maybe nobody ever took the time to do that. For the traveler. And if you explain the science behind it, they can be quite fascinated by it, actually. And, rather than saying you should get this vaccine, you should get that vaccine, say, well, this is how they work. And this is what you can expect, and so on. And give them information so that then they're less fearful. Sometimes people are worried that vaccines might have some long-term side effects, and you can reassure them about that. You can tell them about the safety profile of the vaccines have been very well studied, and you can also reassure them if they have some kind of injection anxiety or needle phobia. That's an issue actually for travelers. Sometimes they're afraid of needles. And in that case, it's really hard for them to concentrate on what you're saying. They'll be thinking just about the needles. So again, we'll sometimes defer if time allows, not if they're last minute traveler, but if time allows, we can defer the consultation or at least the administration of the vaccines for another visit and give information, and then the traveller can come back and decide what they want to receive. You're correct in regard to yellow fever. So that's compulsory for travel to certain countries and for travel from one country to another from a yellow fever endemic country. But for other vaccines, we would call them recommended vaccines. So it's up to the traveller whether or not they want to accept them. And as long as you explain the incidence of the disease, how it might be transmitted, how they might be at risk, how the vaccine, to what extent it can protect them, and the vaccine efficacy rates in travel medicine are really very high. So then the traveller can make up their own mind. And I always say that actually, if there's a group of them, some may decide, no, I don't want to get that particular vaccine, but I'll get this. You can't compel them. You just give them the information, you record that. That's all you can do. But I think if you take a compassionate approach where you really listen to the traveller, show respect for them and their health beliefs, and give information in a very open way and allow them to ask questions. I've certainly, I think over the years, persuaded people who are vaccine hesitant to receive vaccines. And then at the end, they felt good about it because they felt they were protecting themselves. That's all we can do really as travel health providers.
Thank you very much for your insightful insightful opinions. I just have a quick question directed at Professor Flaherty. So, as we all know, modern technology has changed the way that we go about our lives. So, with so many different applications, how can modern technology assist travelers in making an informed decision during their travel preparations?
Yes, that's a good question, Justin. You're thinking of the future. I think more and more people are consulting apps and websites for travel health related information. I think it's a very good thing to do before you attend a clinic, because you can go to the clinic then having used, for example, a generative AI tool, better informed to get the baseline information, and then you may have residual questions which can be elaborated upon the consultation. So we're trying to see, well, where does the consultation fit in with that? And there's certainly been some good studies using generative AI technology. But the danger is that the information may not always be accurate. The sources may not be clear, and there can be hallucinations, of course, from the output. So people should not use those in isolation. But I think in the future you will see the travel clinic incorporating these into the advice they give as they get better, as the algorithms are trained on more comprehensive data sets. Then what you'll find is the quality of the output might be sufficient, for example, to provide that as a handout and reinforcing the information that you give at the clinic. So I think AI will definitely have a role. Virtual reality might be a good way to prepare the anxious traveler. That will be good. Give them an experience of what they might expect before they go. Augmented reality, very useful during travel. That's already being used, but more in a sort of a tourist information context. But if you could use AR to alert the traveler about certain risks, that might be good. And of course, mobile health technology, there's lots of apps where a traveler can get useful information about the disease risks at a destination or the environmental conditions, like the temperature, the humidity, and the air quality. And that's very, very helpful. Somebody, for example, with asthma might want to know what the air quality is. So yeah, they're already being used, but maybe there isn't very good guidance on how to use them well. But I would suggest that some travelers make great use of mobile technology, but hopefully to supplement the advice that they get from a travel medicine provider.
So here's hoping we get to continue having this good balance, and hopefully in the future, AI, modern technology can continue to enhance this field. So, all right, I think that wraps up today's episode. So it was something productive for the speakers, something informative for our audience as well. So thank you so much to Professor Flaherty and Dr. Justin for your insights. And to our listeners, we'll see you next episode.
Thank you very much.
Thank you very much.
Thank you both. Thank you, Prof Gerard. Bye.
Bye-bye.
If you liked this episode, hit the like button and share it with your friends.
For more updates, find us on YouTube, Instagram, or Spotify.
If you have any questions, do put them in the comment box below or DM us on Instagram.
Until then, this is the Via Sana team signing off.